Hello guys, welcome to our YouTube channel. Today in this video we will discuss about most important topic, hand hygiene. What is hand hygiene? Its type and step of hand hygiene. Let's start.
Hand hygiene is a crucial practice to prevent the spread of infections, including viruses and bacteria. Proper hand hygiene involves washing your hands thoroughly with soap and water or using hand sanitizer when soap and water are not readily available. Here are the steps for effective hand hygiene. Using soap and water. 1. Wet your hands. Start by turning on the tap and wetting your hands with clean, running water. Make sure your hands are thoroughly wet before applying soap. 2. Apply soap. Use enough soap to cover all surfaces of your hands. This includes the front and back of your hands, between your fingers, and under your nails. 3. Scrub your hands. Rub your hands together vigorously for at least 20 seconds. Be sure to scrub all areas of your hands, including your fingertips and the areas between your fingers. You can sing the Happy Birthday song twice to help keep track of the time. 4. Don't forget your wrists. Pay attention to your wrists and the lower part of your forearms as well. These areas can harbor germs too. 5. Rinse thoroughly. Hold your hands under clean, running water to wash away the soap and loosen dirt and germs. 6. Dry your hands. Use a clean towel or air dryer to dry your hands thoroughly. Make sure your hands are completely dry, as wet hands can harbor germs. Using hand sanitizer. 1. Apply sanitizer. If soap and water are not available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. Apply enough sanitizer to cover all surfaces of your hands. 2. Rub your hands. Rub your hands together, covering all areas, until the sanitizer has dried. This usually takes about 20 seconds. Make sure to get between your fingers and under your nails. It's important to note that hand sanitizer is not a substitute for hand washing with soap and water when your hands are visibly dirty or have come into contact with harmful chemicals. The World Health Organization recommends a set of 7 steps for effective hand hygiene, which are often used in healthcare settings. These steps are as follows. 1. Palm to palm. Begin by rubbing your palms together to spread the soap or sanitizer. 2. Interlock fingers. Interlace your fingers and rub them together. Make sure to clean the areas between your fingers. 3. Palm to palm with fingers interlocked. Keep your fingers interlocked and rub the backs of your fingers against your palms. 4. Fingernail scrub. Scrub your fingernails by clasping your fingers of one hand and rubbing them against the palm of the other hand. Repeat for both hands. 5. Thumb scrub. Hold your thumb with the opposite hand and rub it in a rotating motion. Repeat for both thumbs. 6. Fingertip scrub. Clean the tips of your fingers by rubbing them in the opposite palm in a circular motion. Repeat for both hands. 7. Wrist wash. Finally, don't forget to clean your wrists by rubbing them with your opposite hand. Whether you are using soap and water or hand sanitizer, following these 7 steps thoroughly ensures that you clean all parts of your hands, including areas that are often missed. Hand hygiene is crucial for reducing the transmission of infections and maintaining good health. The 5 moments of hand hygiene is a framework developed by the World Health Organization to guide healthcare workers in when to perform hand hygiene in clinical settings. These moments are critical to preventing healthcare-associated infections. Here they are. Before patient contact, perform hand hygiene before coming into direct contact with a patient or their surroundings. This is important to prevent the transfer of microorganisms from healthcare worker to patient. Before aseptic procedures, prior to performing any aseptic or sterile procedures, such as inserting a catheter, dressing wounds, or handling surgical instruments, healthcare workers should clean their hands thoroughly to prevent contamination. After body fluid exposure risk, after any contact with a patient's body fluids or potential contamination, example after touching a wound, handling body fluids, or changing a diaper, hand hygiene should be performed to prevent the spread of infection. After patient contact, hand hygiene should be practiced after coming into contact with a patient or their immediate surroundings, even if gloves were worn during the contact. This is to remove any potential contamination on gloves or hands. After contact with patient surroundings, clean your hands after touching surfaces and objects in the patient's environment, as these surfaces can harbor infectious agents that may be transmitted to patients. Adhering to these 5 moments of hand hygiene is essential in healthcare settings to reduce the risk of healthcare-associated infections and protect both patients and healthcare workers. Proper hand hygiene at these critical junctures can save lives and improve overall patient safety.
Thank you for watching this video. If you like this video, like, comment and subscribe. If you already subscribed my channel, then hit the bell icon.